Moskowitz, thank you for agreeing to come on our show, Seeking Truth and Justice. And one of the questions that I think of would be paramount, and we would like for you and also Dr. Clark to address the question of, do you trust the healthcare system in America?
Well, I really appreciate the chance to be on the show. And I would like to answer in the negative. I do not trust not only the American healthcare system, but the global healthcare system. I think it no longer pays any attention to public health. It no longer initiates. It no longer wants to cure or prevent disease. It is only interested in maintaining the lucrative status quo. I adduce as evidence what has happened with my protocol for preventing over 90% of dialysis for the past 30 years. Nobody in the healthcare firmament, from the WHO to the National Health Service in the UK, to Medicare in the US, to the Canadian National Health Service, to the Peruvian Institute of Kidney Disease, to the NIDDK in Bethesda, Maryland, to any of the European kidney authorities, to the ISN, none of the professional groups in nephrology have paid the slightest attention to my protocol, and instead discuss how they're building more and more dialysis units in the third world, like Africa, and how they can get more dialysis units built in India. And soon they'll have 300 million diabetics in China, half of whom will require dialysis as well. So instead of operating like the doctors did in the 1950s when Jonas Salk invented his simple polio vaccine with heat-killed viruses, the healthcare establishment, to a man, is ignoring public health and opting for insane profit instead. And so, no, I don't trust one little bit of the healthcare system, and I think it needs a total reform. And COVID is just the latest example of how a few megalomaniacs can completely ignore science and good clinical medicine and public health common sense to generate billions of dollars for a handful of companies.
Question I have for you: do you trust the healthcare system in America?
That's a loaded question when you ask, do you trust the healthcare system? I would say, we look at it from a percentage basis, I would say 60-40. I think that's the best way to look at it. I wouldn't say walk away from it, because I do believe that in terms of the modern healthcare system, there's a lot to be happy with. I've had a lot of interactions with the healthcare system that have benefited me tremendously. So that's why I have to look at it as both what it can benefit and also where those deficiencies are that could be improved. I am a member of the healthcare system. I'm a dentist who's been practicing for nearly 40 years, and I believe there's a lot very positive that happens in the healthcare system in terms of the advancement in technology in treating diseases. I think the advancement in the age of people, say from 40, 50, 60 years ago, where the lifespan might have been 50 to 60, now has expanded to almost 80. So I know that the healthcare system has some very positive things. So, but of course, there's some other aspects of the healthcare system that don't equitably serve everyone. And knowing that this contributes to a healthcare system that does not treat everyone the same, does not give parity, then we can't just say, well, we trust the healthcare system. We do come from a history, particularly of minority populations, where we have not trusted the healthcare system because there's been a tendency over time to utilize us as experimentation, such as in the Tuskegee syphilis test, or we've been used in various times another in trying to test radiation. There's history of using African American people, particularly for learning how to do surgery in different instances. There have been instances where people have been they've been surgery been done on people who were not anesthetized. So there are a lot of reasons not to trust the healthcare system. But when you look at overall where we are in a modern healthcare system, particularly in the West, in the Western culture, there's a lot to be said positive about the healthcare system and what it can deliver.